joining me on YouTube or on Facebook. I've got a real treat for you today because we're going to help you get your bones strong, you guys. This is so important for women of every age. And I have an expert on bone health. This is Maria Rigopoulou. She's coming to us from the UK. She's in London right now. And what a treat to have you here, Maria. Thank you so much for joining. And I wonder if so let's start off. Hey, you guys, stick to the end because we're going to give you some very handy tips for you to strengthen your bones. Okay, so that's what we're talking about. That's so important for women. Maria, welcome.
Well, I'm so happy, to be here with you.
Yay. Well, so I think a great place to start, I like to ask people how they got into doing what they're doing, because I know you're passionate about this. Can you tell us a little bit about your journey?
Sure. I since a very young age, I struggled with my eating. So I was never diagnosed with an eating disorder, but I did have obsessive behaviors around food. So I was excluding fat from diet. Sometimes I was going through extreme diets and things like that. It was coming from, I don't know, really, just trying to mimic what I was reading in the magazines and, looking nice and thin. I think a lot of girls at a young age, especially now with Instagram, it's even worse. But even then, it was still quite a thing. Because of that, at some point later in life, I ended up with osteoporosis. I discovered it by chance. I had a fracture, so I just fell over. I had a fracture, I think it was my elbow, my right elbow. And I didn't expect to because it was like, it wasn't a bad fall or anything.
Mm-hmm.
So one doctor suggested I do a bone density scan. I didn't have a clue what this was back then. I didn't have anything to do with, being in the health industry or being a health practitioner or anything back then. I used to be an electronic engineer and working for big corporate telecom companies. So I didn't have any clue. I did have my bone density and they told me that I have osteoporosis. I was 30 or 31 when this happened. And I was shocked. I didn't know anything about it. And I was scared because they told me horrible things. They told me that I have to take some drugs with certain side effects, biphosphonates, that I've learned. I didn't know anything back then, but I didn't feel confident of taking them anyway. And they focused a lot on me taking drugs and me avoiding doing things and just moderating everything in my life. And as a young woman, very active and, very much at that point, I was feeling very much alive, but being told all that, I don't know, it was devastating. That I had to go and scan myself. I mean, get like x-rays on my spine because my spine was in such a bad state that I could potentially fracture it very easily, and I should stop doing yoga and I should stop doing that. And I was just completely terrified. So that's how it all started. The first stage of my life kind of like ended there. I had a breakdown. I left my job. For a couple of years, I wasn't doing anything. I started researching. I decided to go back into studying, which I did, nutritional therapy, functional medicine, nutrigenetics later on. And initially, I did it to heal myself on the way, and from the practice clinics, even when I was still, studying for the nutritional therapy, I realized that this is what I love doing, just being out there and helping people. And initially, I was very, I want to say, shy, and I didn't want really to talk about my story and to share my issues, the problems that I had with well, I had like chronic amenorrhea, really. I didn't have any periods. My estrogen levels were very low. My fat levels were very low. And it was difficult to get all this back to normal. And this is why one of the reasons the nutrients were not in when they had to, when I was very young, but also I didn't have any normal periods for a very long period of time. So my estrogen levels were very low, and that contributed to not even reaching my bone density, actually. The peak density, I never really reached it. So
Let me can I
I've learned,
comment just
yeah.
so people kind of understand. So what happened, guys, is as she's describing is when she was younger, she sometimes would restrict eating and had some challenges with food and didn't give herself the enough nutrients to make the bone you'd usually make when you're in your late teens and early 20s. So she never got up to full bone density that you would expect. And really didn't know about this, but she wasn't having periods. So if you're young women not having periods and you're restricting, this can affect you lifelong, right? So that's why this is so important. If you're not having periods, guys, you need to talk to somebody. And then she just found out because she had a little fall and broke her arm. And then the doctor's like, look, your bones. And so just so people really realize that this is very important for all ages, because now, as we get older, our bones will start to, we start to lose some bone density. So you went back to school, basically.
I went back to school. I, trying to heal myself, understand a lot more about the condition. In the beginning, I was, dealing with the eating disorder. It was the most difficult part. And I did receive quite a lot of help doing that myself. And, if there are people, and especially young people, especially women, that they have issues with that, I would say, go there and talk about it and do something to sort it. Because in my case, and from what I discovered, and I still see, in osteoporosis Facebook groups and things like that, a lot of young women end up with osteopenia or osteoporosis because of disordered eating or some sort of like obsessive behavior around food. So the first thing that they have to do, the first thing that I had to do to start seeing results and feeling better physically, emotionally, mentally, spiritually, at all levels, it actually healing my relationship with food. I didn't do it immediately because that was kind of like, it was a difficult thing for me, but that what really made the difference in my own case. And I see that being a very common theme, a very common pattern happen with many young women ending up with osteopenia. So I would say, yes, of course, if you do learn, you're young and you do learn that you have osteopenia or osteoporosis, yes, of course, focus on that. Do as much as you can to build better bones with exercise, with certain nutrients. But don't forget to look about the root of the problem. What is really the root of the problem? Is it the eating disorder? Is it genetics? Is it some other form of hormonal problem going on? Thyroid? Are you diabetic? I mean, early onset osteoporosis could be because of so many different reasons. So try to find the root first. As you also know, in functional medicine is the number thing that we need to do. So osteoporosis is not.
Well, I was going to say that the big tricky thing, you guys, is that if you don't, Maria fell and broke a bone, and that's how she found out that she had this problem. If you've gone for extended periods of time without periods in your teen and 20s, that is a sign that maybe you should ask someone to check your bone density to see where you are, because the only reason she found out, and now there's still something that she can do about it. There's things that she could do about it. And we'll talk more about those, and she's going to tell you sort of some of her tricks, but we have to have the the thought, oh, maybe my bones are thin, right? And most young women would not even think that, right? Wouldn't be considered.
Yes, true, true. So what I noticed is that then when they go into the 40s, in perimenopause or just before that, that's when, normally you would check your bones, you would do some sort of bone density scan, and they end up with very bad T scores, or Z scores. Usually they use the T scores. Everyone, the doctors anyway, in Western medicine use the T scores in DEXA scans, and they have, quite severe osteoporosis, and they wonder how this happened to me. I'm only 40, 2 or 40 or 38 or even younger. Some things, sometimes you have people like 38 or 39 or 35, and they have quite severe osteoporosis, worse than mine, and they don't really understand how it happened, and then they go like, oh yeah, but I was dieting and I was a fruitarian or whatever for 10 years, and yeah, of
So,
course these things happen. Of
right.
course, you will end up with severe osteoporosis at a very young age. So, yeah, it's very, very, very important to raise more awareness about that. It's something that it's really, really rare to find in, magazines or discuss in social media. It's considered as an old people's disease, and it's not. It is not.
Right. I mean, you are really doing a service to everybody to bring this to light and to open the conversation more, because I know that even me as a family doctor, so I don't always ask people about if they have a history of eating disorders. And I in functional medicine now, we always tease that out. That's really important. But 20 years before I went into functional medicine, it would be something that I would like to say I asked everybody, but a lot of times people are shy about it. They're embarrassed about it, and they don't really want to talk to you about it. And so, you family doctors out there, this is something so important to ask people about it. And it's really will change life trajectory if we get this managed early. So you decided you opened the book, you went to school, learned all about functional genomics, functional nutrition, functional medicine, and now. You are working with people really focused on this early menopause with people. And I know that you went kind of a natural route. What route did you take to, first get yourself? I mean, the first thing you said was, we've got to make that relationship with food healthy. How did you move into that?
I mean, first and foremost, especially if I feel sometimes, people outside don't talk about it, but if, there is the indication that there is some sort of obsessive behavior, some problematic behavior with food. So that's the first thing to do. And in most cases there is, but, not always, but in most cases there is. So that's probably the number one thing to do. And you start with the basics in this case, but the basics are the fundamental things to do. Some people already know a lot of things, especially if they have some sort of eating disorder. They know a lot about healthy eating, but maybe in a kind of restrictive way. So you just really trying to reestablish, if they have restrictions around food, just finding ways, depending on the person, to broaden that, to make it less scary for them.
Making friends with your
very
food.
important.
Yeah.
Yes, exactly.
Yeah, and
So
because it's hard for people to go from restrictive to healthy. It's a path, right?
It is a path, and for many people, I mean, thinking about myself as well, in the past, I thought that restrictive way of eating was healthy.
Right.
So for many people think that this is healthy. And what I bring, an additional element that I bring into it is, when looking into genetics, and I use like different laboratories and different tests, depending on, again on the case, is that for some people that certain types of diets, I don't want to use these words because I still that it's restricted. The word like diet, paleo or this or that is quite restrictive in itself. But
Styles
there's
of eating,
certain
maybe.
styles of eating. For example, more of plant eating or less, or including meat or not. For some people, genetically is better, and for some others is not. And that is true. So I'm also bringing genetics into that, and planning the, I wouldn't say ideal, but the better fit for the person genetically as well. But looking at emotional and psychological factors is very, very important. So these are the first thing is the nutrition. Then of course bringing the nutrigenetics knowledge into it as well. If people have already done a lot of testing, and some already have done a lot of testing, of course, need to take this into consideration too. In many cases, in early onset osteoporosis, there are a lot of other conditions that have contributed to that, but there still exist. Some form of autoimmunity, for example, Hashimoto's is a very common one.
And really,
that's
Hashimoto's, guys, we have to heal the gut for that. We've got to heal the gut, right?
Absolutely, yes. Celiac or any other of disease or disorder, even chronic IBS that can has an effect on nutrient absorption. Even that is a contributory factor. Okay, it might not be massive, but think about someone who has extremely sensitive gut and have chronic IBS for a very long period of time, up with some form of medication like PPIs for for reflux or something similar, which actually make things worse long term.
Right.
These people are going to end up with some form of bone loss much younger than what they think they would.
Right. So true. Well, so let's talk about, so the first thing there, I think it's really important that you mention is that we want to get sufficiency, nutritional sufficiency and healing of the gut, way critical. And then, the other thing is, I think the hormone aspect is pretty important. So that hormone aspect is important, and trying to get more balance, because your estrogen also will feed into bone health. So you have to have the balance there hormonally. And then the other thing that I'm imagining, do you work much with people on posture? Because this, is so, that's something I think about. Tell me a little bit about what you do with folks with posture. Do you just talk about it?
Well, I mean, not, I wouldn't say posture, but, in general, exercise and ways to move, and how you can do that, not only to improve your bone density, but also to protect yourself from injuries, and then to have, some form of quick recovery. Because another thing that I noticed from myself, but also from other people with that suffer with, some form of bone loss, is that we tend to be quite prone to injuries. And I'm not sure actually, but that's kind of my theory. I think if there is something quite serious happening with your spine, you kind of like losing your sense of balance somehow. So what I've noticed with people with severe osteoporosis, especially on the spine, as I have, and I mean, mine is, is quite severe, but it is, it's you can find worse, of course, is that we don't have that very good sense of balance. So it's not only about posture, but things, for example, like Pilates that I have used, other, the reformer Pilates or mat Pilates and things like that. I find that very useful. Yoga that I have been practicing for 20 years. Again, for certain people, if they haven't done any yoga, never in their lives, and they're diagnosed with osteoporosis now and they start yoga now, they have to be very careful. So there are certain things that, so very slowly, and there are certain things that they shouldn't be doing. So this needs to be, with someone. I mean, of course, when I do the one-to-one advice, I do give the exact advice to the person what to avoid to do and how to get into certain poses and everything. And then, of course, is some form of resistance training. My favorite is not, I mean, if you go to the gym, all these machines are really built for people to build, big muscles, the kind of like bodybuilding, body. They're not quite great for bone density, but, exercises like planks, for example, if you do have the fitness to do things like that, or using bands, rubber bands, very good resistance training.
Do you ever wear a weighted vest when you walk? What about weighted vests?
Oh, yeah, absolutely. Weighted vest, absolutely amazing. I totally recommend them. Again, they have to be introduced like gradually.
Slowly. And
yes,
really slowly, right? The other thing about weighted vests is if you put a weighted vest on and you're standing like this, guys, it's not gonna help. So when you get your weighted vest, it's important that you do this. Your shoulders are back. You're standing up when you're wearing your weighted vest because it's a column of blocks. Your spine is, and they need to be weighted vertically. And so if we are walking with our weighted vest and sort of like walking fast, so you need to walk slow with a weighted vest, because as soon as we walk even a little bit quickly, our head goes forward and we're starting to accentuate the curvature. So, I mean, I think that everybody, if no matter whether we have thin bones or not, we need to focus on that standing up straight, especially if you're using the weighted vest. The other thing that I think it's important people understand that there are things to stimulate your bone growth, right? Estrogen stimulates bone growth. Muscles stimulate bone growth. So just like Maria is saying, we want to go gently, and we really do want you to put on muscle that's supporting your spine. So these exercises, slowly moving into exercise, is really the only way that you're going to start to get stronger bone. And because I think conventional medicine gives up on people. They're like, oh, let's just see if we can, give you some of these medicines that is going to make you maybe feel bad, maybe have side effects. And they don't see that there are natural ways to get stronger. One of them is have you ever heard of blood flow restriction bands, Maria?
No.
So this is something that has been shown in case studies to improve bone density, and basically what it is it's something that people use for weightlifting, right, to get stronger, but we're using it to get stronger and to build bones. They're inflatable cuffs. Let me see if I have something I can share with you. The Be Strong bands. Yeah, let me grab a picture of this so you can see it. Here, I'm going to share my screen real quick and I'll show you, because I think you'd find this interesting. Let me pull it up here, move that out of the way. Okay. Okay, I'm going to show you this really quick.
With the BFR system. And interestingly, the proximal part of the quad coincides with the location of the tourniquet during BFR.
Okay. Oh, heckaroo. Let me see. This is, so here we go. So you can just, guys can get a quick
Heavy
picture
standard training
of
with the
this.
BFR system.
And
And
I'm just jump in
interesting,
here. Later on, he shows people doing this. But what it is, it's a cuff that goes around the upper arm on both sides, and it's adjustable cuff. And then it's going to go up at the upper thigh also. And so what you'll see is he's using very light weights, super light weights, right? So like 5-pound weights, and it lets you get a really good workout and send a message within like 10 minutes to your whole body that tells your body to make more muscle and make more bone, because when we make more muscle, we actually are yanking on the bone. We're going to create stronger bone also. So that's the, and they've done some case studies with people showing increase in bone density. So that is something that you might be able to add to your armamentarium.
Yeah, I mean, I've never heard of that, but it's never, it's definitely looking very interesting. Yeah, I mean, the vest is really, really good. Of course, in this case, the posture especially is very, very important. As you said, start gradually, get a good vase that has, all the weight is kind of distributed around the whole body. So front and back. That's also very important. And yeah, I mean, start and get one that you can actually modify the weight. So you can, start with a little bit of lower weight. And then when you see that you get stronger, you get a little bit higher. Never overdo it is very, very important. Personally, I also like very much, and I saw actually a difference in my bone density slightly improving on the hip area when I start using the lower vibration plates.
Yeah.
The Live ones. So there are different brands. I don't want to advertise any particular brand, but they're really, really good.
There needs to be a little caution with people with eye issues because of the vibration. But I do also, vibration plate therapy can help improve bone density for sure. There's a new phototherapy patch that has been shown to reduce markers for bone breakdown and improve muscles. So that's something I use with my clients, the phototherapy patches. The X49 in particular is the one that they did a bone density study with X49 and showed that drop in bone breakdown. So it's preliminary, but it's very interesting. It also show increased muscle mass. I'll share that with you, Maria, that study. So what I think that I know we have like about 7 more minutes before I have my next interview to go on to. So let's see if we've talked about so much. What's the important message that you want to get across to somebody who's watching this?
Well, first of all, if they have been diagnosed with osteopenia or osteoporosis, it's not the end of the world. I lived with it for 20 years. I discovered it when I was 30. I was, lucky enough to discover it there. So I managed to actually stop it in its tracks. So yeah, I mean, don't panic. Research, learn about it. Understand, I mean, if it's happening to you as a kind of like natural part of the natural part of like growing up and being older, becoming older, then it's fine. If it happens at an early age, just look for the root cause, and that is what is important. So ask questions, ask your doctor or your practitioner, ask questions to understand why this is happening to you. Ask yourself, because most of the time you kind of have an idea why this happened to you.
Because it just doesn't happen out of the blue when you're young, guys. There is a reason. Okay.
It doesn't. Yeah, I mean, I had woman the other day, and she was like, "Oh yeah, I was diagnosed with osteoporosis, and I don't know how this happened." And I was asking this, and that, and then she said, "Oh, by the way, yes, I have been taking thyroid medication for this." Okay, so, or I have been taking steroids because of this reason. And then you go like, okay, this is another risk factor. So this is the first thing. And if they think, or if they worry that, other than man or woman, it doesn't matter, that they might be at risk because there's some sort of like family history, or because they are in one of these risk groups that we discussed, there's some sort of autoimmunity, celiac, Hashimoto's, eating disorder, problems with periods, having amenorrhea for whatever reason, because of an eating disorder or another reason, taking steroids. If there are, diabetes, if there are in these risk or high risk groups, ask for a bone density scan. I mean, okay, DEXA scans, not perfect. That's a long discussion. We probably need another interview to discuss that, because this could be quite misleading, the readings, as they are in my case, for example. But I mean, ask for a bone density scan, check your vitamin D levels, check your urine telepeptides and TX telepeptides. I mean, these are very routine tests. They're not perfect, but in most countries are free. You can get them very, very easily through the normal, system, whatever it is, and they give you some information, so So I mean, learn about that. So these are the messages. I mean, if you have been diagnosed, don't panic. Research, ask questions, find the root cause. And if you haven't been diagnosed and you are in one of these risk groups, or if you're not in these risk groups, but you still worry because bone loss happens to everyone. It's true. It's just sometimes it can happen earlier, and if we can stop that, that's even better. So
definitely better to stop it earlier. I think it's interesting that recently the recommendations on oral steroids and inhaled steroids for people with asthma, basically they're saying to really try and avoid oral steroids. So it used to be that like people with COPD, they might have like some steroids ready to go if they had an exacerbation. But these days we really want to avoid those as much as possible, because one of the things they do, besides dropping your immune system out, is they reduce your capacity for making bone. And so I love your message of hope. You guys don't believe them when they say you can't exercise. Okay, that's really important too.
I mean,
terrible advice not to exercise because you have
osteoporosis. With osteoporosis, I do my exercise. I do daily yoga. I do hike. I probably feel better than what I used to feel like 5 years ago, because I do more strength training now than what I used to do. And my last DEXA scan was actually slightly better than the one that I had, I think, 4 or 5 years ago. I mean, so it is possible. And
definitely. All right. Well, gosh, I wish I would like to talk. Well, we should continue this again in the future. But this has been so helpful to me, and I'm sure helpful to people who are watching this. So Maria is in London now, and then she'll be in Athens after the new year, and she is available to help you to be your bone density coach, especially if you have early onset. And if you have any questions, I think, Maria, we could find you on Facebook, right? And
yes, on Facebook and Instagram. I don't use very much, but I mean, if you search my name, you will find me pretty easily, I think. So thank you so much.
Well, I appreciate it. All right, I'm going to say goodbye to our live streamers. Bye, you guys. Make sure you